really interesting things. If you've not made it to watching the news in the last few days and hearing about the new proposals before Congress about Medicare, you're going to be very interested to see what's been proposed by our Democratic friends across the aisle, as they all say. I'm not surprised by it, but I am pretty sickened by it. And if those of you that came from the underage medical insurance, the major medical world, will probably know there's been a consistent effort on the part of some people in Washington to do everything they can to get rid of the capitalist system that we used to enjoy, led by our president and his counterparts. But let me share with you specifics instead of my opinion. And I know we're a couple minutes after, and we've probably got a few people that are able to join us now, 47. So in case you haven't been watching the news, I've got it all here for you, but I can actually show it to you as well. You know, we kind of dodged a bullet last week in the debt negotiations because one of the things that was on the chopping block was part of Medigap, which actually it's Medicare that Medigap steps in and pays the deductibles and coinsurance for. The proposal was to make it illegal for Medigap plans to pay first dollar coverage like Plan F does, and they barely averted that. Got the article right here. It says several plans to reduce federal spending have included other proposed changes to the Medigap plans. Most recently, a package of $250 billion in cuts tentatively agreed to by Obama and Speaker Boehner before the debt ceiling negotiations fell apart. Under that plan, this is the one that didn't pass, Medigap would no longer cover as many out-of-pocket Medicare costs, something that could save Medicare between $1.5 and $4 billion in 1 year, according to a Kaiser study. But the interesting thing is, the reason why it would save Medicare money is because seniors could not have first dollar coverage from their Medicare supplement policy. So that means they would not get the care and treatment that they would ordinarily get if it was paid for by insurance. So they're saying we want to save money on health care and Medicare. They really don't want them to have those procedures done. That's the only way to get those cost savings. Well, we thought we dodged a bullet, but in fact we didn't, because it actually has been proposed another way. Take a look at this article from the Commonwealth Fund, and if you can read the mice type there, 2 Democratic lawmakers on Tuesday introduced to, no, that's his wrong study. Let me see. Hang on, I got it. Maybe I don't. I'll just read it on the screen there. Require Medigap plans to meet the same medical loss ratio standards as private insurance. Anybody remember the medical loss ratio and how it applied to private insurance? We're talking about major medical here. If you don't remember that, let me see if I can find it for you. And this is exactly what the MLR did for underage health insurance, for those of you who didn't sell it before. This is very important.
Good day, I'm Jackie Judd. If you've paid attention to the details of the health care reform law, likely you have heard about MLR. MLR stands for Medical Loss Ratio. It refers to the amount of money most insurers must spend on medical claims and health care quality improvements, about 80%, versus what they spend on administrative costs. What does that mean for consumers and for the brokers who make a living selling health insurance? Here to answer those questions and more is Insuring Your Health columnist, Michelle Andrews. Welcome, Michelle.
Hello.
What is in this, in the MLR, potentially for consumers?
Well, I think it's really a measure of value, that consumers should get value for their premium dollars, and that the vast majority of the money that they're spending out of their pockets for their health care should go toward the medical care that they receive.
And not the administrative cost, not the marketing cost, not the
profits.
Salaries, the profits, etc.
Pay very close attention to the woman's reaction when they talk about the business, the future business of insurance agents. Very telling here, because this is not.
The insurance industry has a very, very different point of view, particularly the brokers and the agents who sell health insurance. What is their perspective on this?
Well, the brokers see it as a real problem because if their commissions are included in the administrative costs, then insurers now will have an incentive to reduce the amount that they pay in commissions because they can only put about 20% of their costs toward administrative fees. So brokers are worried that this will basically run them out of business.
And there's significant money at stake here. The National Association of Insurance Commissioners, according to the Senate Commerce Committee's preliminary analysis of data, shows that the potential consumer rebates would be cut almost by half if the agent commissions were excluded. So there's a lot of money at stake here.
There's a lot of money at stake indeed.
And is it possible that the law as it now stands may still change? Is Congress considering altering the outline of this?
There is a proposal that is under consideration, and I think there's a lot of discussion going back and forth about whether or not that's the right move. Of course, consumer advocates are arguing against it.
What is their argument?
Well, they are making the argument that if brokers are allowed to pull that money out of the administrative calculation, then that's a lot of money that's going to come out of consumers' pockets, because premiums then will be allowed to be higher than they would be if those commissions weren't included.
You wrote in one of your columns, I think you raised the question of, do insurance brokers face the same fate as travel agents, who have become very much less relevant in the process of travel these days?
Yes. Well, some would say that is an inevitable result of this kind of change, and it's going to happen whether or not their commissions are included in the MLR ratio. I'm not the expert on that, but I think that that's a real potential.
There was one early sign of how the MLR might work in practice in next year, when, if there are going to be rebates.
Okay, so Ryan has texted me in my phone over here and said that this is GOP and Democrat. I hold in my formerly nicotine-stained fingers. No, not really. Look at the part that's in yellow here. Actually, let me show you on your handy-dandy screen. It should be page 2 of the Commonwealth Fund, but it's not. It says here, Americans have House Democrats Henry Waxman of California and Frank Pallone Jr. of New Jersey are original co-sponsors of Stark's measure. Let's see if we've got the Common Fund, page 2. Oh, well, I'll do one better. I'll send you the link so you can see it yourself. Here it is. I'll put it in the chat window. If you click on that and you're using Firefox and Google Chrome, it'll open in a new window. You can read it at your heart's content. Here's the important part. House Democrats Waxman and Pallone are original co-sponsors of Stark's measure. Staff members for both authors said that no Republican lawmakers have signed on to this bill. The standards would be effective in 2014. And basically, if you're joining us late, what this proposes to do, and it's a bill that's about three sentences long, and all it does is it changed the medical loss ratio requirement that's currently on major medical, which is under 65 health insurance, to apply also to Medigap plans, otherwise known as Medicare Supplement. It will require insurance plans in the group market to spend at least 85% of premium dollars on medical care, and insurers in the individual market, talking about Medicare supplements now, to spend at least 80% on such services. Let's see, and then it says this has been left alone since 1990. Currently, just so you know, MLR for Medigap policies on an individual basis are at 65%. So it'd go from 65 to 80%. Guess who lives in that little 15% range? That's right, you. And then I highlighted this portion of the article where it says, Americans, this is a quote from the liberal Democrats, Americans have long paid to line the pockets of insurance executives with their premium dollars. And then down here in the highlighted portion, you'll see there's only one entity that's sponsoring that supports this. That's a high-def camera there, baby. Anybody going to read that? Okay. I'll read the other part. It says, insurance companies should be spending their customers' hard-earned dollars on health care, not administrative costs, says AARP Executive Vice President Nancy Lamond. Several plans, I already read that. Oh, you got to read this one. This is on Before It's News. Let me pull this one up. Yeah, you got to see this one. Before It's News article. Read this one down in the interesting part under Dr. McCain's comment. Listen, here it comes. This is handy-dandy research here, folks. See under it says Dr. McCain's comment right there about the middle of the screen. It says, Medigap policies are private insurance plans. We all know that, duh. Here's the next sentence. They are quite popular because of the exposure that Medicare beneficiaries have to relatively high out-of-pocket expenses. They also represent one of the worst values in private insurance. This is their opinion now, because of their very low medical cost ratios. Heroes Pete Stark and John Kerry have introduced Medical Loss Ratio Improvement Act. Let me go to the next page so you can see that. Story page 3. Here's the best part. I made this big so you could see it. Oh crap, I don't think you can see it on there, sorry. It says their marketing costs are similar to competitive plans. The insurers are in a real bind. Let's see if I've got it on there. Before It's News, is that the right article? This was just put together late this afternoon, so I apologize if you can't see it. Let me go back on page 2 and see if you can see it there. There it is on the bottom. The insurers are in a real bind. They can't reduce their administrative services yet because the plans are only supplements. They can't pay out much more in benefits. So they're paying out benefits. They can't pay much more in benefits because these are only supplement plans. So my opinion is stay the hell away from them, right? Requiring the same medical loss ratio as applied to comprehensive plans would, this is it, destroy the Medigap model. And insurers would have to withdraw these plans. You can see it right down there, right at the bottom. Can everybody see that? Okay, now let me go to the other page where this liberal Democrat shares his opinion. That would be good since these plans are such a terrible value no matter how much how you cut it. But we have to keep in mind why these plans exist. Here it comes. Here's the agenda. Medicare benefits are inadequate, leaving beneficiaries exposed to excessive costs. To eliminate this wasteful private industry of Medigap plans, catch that, to eliminate this wasteful private industry of Medigap plans, the appropriate solution would be to reduce or preferably eliminate the out-of-pocket cost sharing of Medicare. Now you remember that the reason why they were going to pass this other bill to save a whopping $25 billion over 10 years was so that seniors didn't have first dollar coverage. Because if they have first dollar coverage, what happens? Utilization goes through the roof. They go have that surgery they've been putting off. They get that hip replacement because they can. That's what Medigap has let them do. They pay for insurance. The private companies step in. I'm just preaching to the choir. Yes, I know. But it lets them get the things done that they wanted to get done. This idiot liberal is saying what we need to do is have the government, the taxpayers, pay for the first dollar coverage. He's saying it right here. Reduce or eliminate out-of-pocket cost sharing of Medicare. He wants us to pay for first dollar coverage, not seniors with private insurance. So they absolutely want to get rid of Medigap plans, Medicare supplements. Although that reintroduces the moral hazard, and this is one of those air quote things, issue of free health care, other nations have shown that comprehensive free health care can be provided at much lower cost than ours. If you were here at the top of the hour, you saw the video from the cardiothoracic surgeon in Canada saying he left Canada because he can't give good health care there. If we're going to talk about morality, then we should ask what is moral about injecting an expensive, superfluous, worthless industry into our health care. I encourage you folks to get out there and make your voice known about this. I'll be sending out more. This just came out, so Senator John Kerry, who blew it going to the White House, is now trying to make his way to screw up the rest of what's left of private industry. It's, let's see, known as Senate Bill 1416 and House Bill 2645. Peter Stark in California, thank you, Mr. Democrat, and Senator John Kerry of Massachusetts. Thank you very much for that. It's now in the Finance Committee in the Senate. You can track the bill. I'll send you the link to do so. Actually, I've got it in my email that I sent to myself last night at about 2 in the morning. But I'm telling you, man, it's every way we go, somebody is trying to, just derail our industry. And we have hundreds of new agents that came to us within the last couple of years from Major Medical because they did this to their industry there. And it blows my mind. All right, I'm going to put the link in here so you can kind of track this bill. You can actually read the bill, but like I said, it's only a few sentences long. That's the one I'm putting in there a couple times so you can not miss it. When you click that, again, it'll open up in a new window, and you can see the actual bill, and you can see down there, View Committee Assignments. It'll take you to that committee where it is. It's been referred to the Finance Committee in the Senate. Co-sponsors are now signing on. Oh, good. Al Franken, his stupid comedic self that stole his way into the Senate, is now co-sponsoring the bill. So Al Franken, the comedic dork, has now signed on. This is since last night. So you can watch this bill in real time, how they're trying to screw up our industry like crazy and hurt seniors by taking away Medigap plans and having them rely wholeheartedly on the government. All right, so I've shown you a couple of the articles there. You know what's happening. Oh, and here we go. This is Mr. John Kerry himself on johnkerry.org or whatever the hell his website is, talking about AARP has endorsed his bill that would impose tighter limits on supplemental plans. That's great. The seniors lobby has backed the bill that would extend healthcare's medical loss ratio. Let's see down here. It says the healthy piece of AARP's revenue comes from Medigap plans. The organization doesn't sell the plans directly, but lends its name to certain policies and collects royalties in return. Republicans have attacked AARP for supporting healthcare reform, arguing that the group stands to benefit if cuts to Medicare Advantage drive up business for Medigap plans. The insurance industry opposes this bill. Things that make you go, Page 2 of this, just zoomed in down at the bottom there, talks about the health care bill, and it says, as supplements, Medigap plans collect lower premiums than comprehensive policy. It's lower premiums. Stay away from them. But the administration costs are not necessarily lower. So it stands to reason, if you're looking at it, that these are small plans. The administrative costs, yes, they're the same as administrating a larger plan. But what it says is the costs are not necessarily lower than the administrative costs, but they're not paying that much anyway. So, leave them alone. All right, that's my rant. That's my soapbox. Thanks for coming. You need to reach out and get involved in this bill. I would recommend reaching out to Mr. Waxman. It looks like a ferret. Look at Mr. John Kerry, who doesn't have a clue. And if you haven't yet, stop buying Heinz ketchup, because that just feeds his stupid campaigns, and he's not even paying taxes on his yacht. But I won't go there. Anyway, reach out to these people and let the Republican leadership in the House know that they need to just drop this thing and not even bring it up to a vote when it comes into the House. I mean, it's already been introduced by Stark, who's always been a wingnut on Medicare stuff in the past anyway. He wanted to eliminate Medicare Advantage a long time ago. And I'll just run that video at the very end of the webinar talking about medical loss ratio, if you missed that part, and what it's going to do to the insurance industry, already has done to Major Medical, and what it absolutely will do. Look how dark that is. Isn't that weird? And what it will do to everything else as far as Medigap plans. So we'll get into that in a second. But there's a positive, bright side, and thanks for coming here today, because I'm going to share this with you. The bright side is, if this does go through, as they want to ruin the entire country, but if they ruin our little segment, it won't take effect until 2014. Experts believe it'd be January 1st, 2014, so we have a little bit of time there. By way of news, real quick, I'll interject, and we do have a really neat free program that you can give away to seniors, give away to anybody, and start up a conversation about their health insurance, their Medigap plans, the Medicare Advantage plans, life insurance, and everything else. It's something absolutely free you can give away. You get paid when you give it away. It's not the diabetic test meters. It's something else that builds residual income for you. It's exciting and doesn't cost them anything at all. So I'm going to share that with you, but real quick, by way of announcement, let you know that Universal Healthcare, which we're really excited about, their trainings have just been announced, and Ryan has been working very hard on putting these together. Thank you, Ryan. all around the country. This is the August training schedule. It's a really ugly link. I apologize. I just got this information. It's just been updated. If you click on that link, it's probably going to open as a download. Going to come right to your computer and open in Microsoft Excel. So you can see a spreadsheet there of all the trainings going on around the country for August. So you need to get plugged in on one of those. If you don't remember, on universal health care, which is the most exciting Medicare Advantage plan on the market this year by all accounts, everybody's saying the same thing about universal health care this year. You have to go to an in-person training in order to participate. They will accept the AHIP certificate, so that's just a 4-hour training. They'll accept that as your training in full for the online portion. If you don't have AHIP, which this year has now gone up to $150, you don't even have to take it. Don't worry about it. You can go register at Universal Healthcare site and get signed up to do their online portion, which just covers the AHIP basic Medicare stuff. But you've got to sign up, RSVP, and show up in person for these trainings. Now, if you're one of the last ones that have not done your your contracting for Universal Healthcare, please don't delay. We're getting this contracting done, the online registration done, and getting everything lined up and training completed before the season starts so that there's nothing in your way. You can hit the ground absolutely running full steam ahead. And the most opportunities for training, which again has to be done in person, is found on that link at the top. So the contracting's down there. If you're wondering where Universal is going to be offered this year, take a look at this link and you will see articles about Universal, and you can see where it is. You also need to get your supplies early, and by doing this process now, you will make sure that you get supplies. There will be a mass exodus of agents still coming from the the health insurance side into Medicare right now. And what the buzzword is in the industry is Universal's where it's at. It's supposed to be the best everywhere that they're offered. So take a look down there, see where they are offered. Make sure you copy that link to the contracting. You can highlight it, copy it, and then paste it over into a browser somewhere else. I don't recommend writing it down because that's a lot of writing, and if you get one character off, it won't work. I had somebody do that last week. They wrote down a link, and there's, as you can see, like with Coventry and contracting, there are capital letters there, and when you're doing a hyperlink like this, the capital letters do matter. They don't matter usually on the internet, but this is a specific document, so you have to have it exactly perfect. Open that up in a new window, and you'll have it later. You can visit with that. That's great. What if you could give away something? Okay, listen, Ryan just gives me an update here. He wants to let you know that if you need assistance with the online registration at all, or the contracting, because it can be a pain, he says, make sure to give him a buzz on the phone. It helps if you use Internet Explorer, because I don't know why. They just have chosen to use Internet Explorer as their primary vehicle for letting online registration happen. That you can write down, and he can send you these links if you don't get them. Write that phone number down. That is Ryan McGovern. He is helpful and willing and able to help you get through that process. It's very quick and easy once you know how to do it. He can do it with you in a screen share and be done in less than 5 minutes. It is a quick process. But if you have any frustration at all on that, don't stay there. Let Ryan help you. Okay, so here we come. The new good thing you can give away and get paid for doing it, and most importantly, generate a lot of traffic. Here recently, I was exposed to 2 different programs that are said to be incredibly effective at getting you in front of people on a favorable basis. Actually, 3 programs. I'll run through them really fast. Number 1, giving away diabetic test meters to people who are diabetics, and we're doing that over at selldiabeticlife.com. And that's going to be a neat program. We have a pilot project underway right now where we're doing that. If you haven't seen that, selldiabeticlife.com. We're the only life insurance agency, our partnership, that has ever been partnered with a durable medical equipment company for the sole purpose of lead generation for life insurance. So far, so good. I'll be reporting to you back on that in the future. However, there are 2 other programs that have been recently brought to my attention. One involves giving away, not giving away, that's the 3rd one. The second one involves selling very low-cost dental plans to seniors. I have no interest in this, but it is very effective because they're only like Humana's DHMO cost, I think it's $11 a month for somebody who's 65 years old. And through telemarketing, you can find people who want a dental plan where they have comprehensive care. It's a very limited in scope network, and it's not available everywhere. But here's the concept, and don't miss that. It's called a loss leader. You go out there to sell them a very small plan that a lot of people want, high response rate with telemarketing and direct mail, and it gets you talking to them on a favorable basis. You show up with a clipboard. I'm here to sign you up for the dental plan. Yes, I'm only going to make $30 on it, but oh, by the way, as a comprehensive analysis at what we do as insurance experts, can you share with me who you have for your health care and are you happy with them? Who do you have for your life insurance and are you adequately protected? Have you had your annual review with that? Let's go over that with you. That model right there with the dental insurance is working great for other agencies. I'm not really interested in it because we haven't tested it yet. So I can't really tell you if that's great or not. I can tell you that the numbers I hear on that are all over the place, that they're selling like 1 out of 2 or 1 out of 3, and that's only the dental plan itself. And then, you know, like 1 out of 10 maybe are getting a policy out of that. Those of you that have been with me for over 2 years, remember the husband and wife team that was in Georgia who went door to door with an ID card around their neck and a clipboard and said, "Hi, I'm with Mutual of Omaha. We're just in the area meeting with our local seniors in the area, and your name's on our list, which will let you know what we have available and see if there's any way we can help you and possibly review what you have right now for your coverage." And that husband and wife team was writing $5,000 a week in business. They did everything: single premium life, final expense life, annuities, single premium annuities. They're doing it all, but they had no gimmick. The gimmick was showing up and working hard, having a list that they went in chronological order through the neighborhood of all their seniors. Not turning 65, that was just everybody. That's cold calling, and that's a pain in the rear. So if you have no money at all, and that's all you want to do is get a list of people's names at 5 cents a piece from USA Data, hey, knock your socks off. It works. It absolutely works, and that's great. But I've got another idea. And this was brought to me by an agent that's in New Mexico, using it with his agents and doing very, very well with it. So I thought I'd go to the source. Now, what I'm going to bring up to you, I can actually show you, so it's a lot better to show you rather than tell you. I want to talk about this program here. There is a portion of this program that is a multi-level marketing program where agents get paid 40 cents per use, and you have to pay all kinds of money to sign up as a distributor, like $100. Well, I eliminated all that crap. Sorry, that's twice I've cussed today on the webinar. Or is it 3 times? 3. Sorry for that. But I eliminated all that, went directly to the source, and got a deal for our agents where it's 60 cents a piece for every one of these cards that we give out. What this is, it's a prescription drug card. Now, before you shut me down and say, well, seniors are on Part D, they don't need it, you're wrong. They do need it. And they want it very, very badly. The auto dialer test that we've done show that out of every 1,000 people called, which cost us less than $200 to do that, every 1,000 people called, 50 people press 1, raise their hand and say, I want this. I want this right now. A lot of seniors that you don't even know about have opted out of Part D. Yes, the drama. They're going to have a 1% penalty per month that they've opted out if they ever in the future wanted to sign up for Part D, but a lot of people don't want anything to do with it. An overwhelming majority of seniors that are near the poverty line don't want, can't afford, and don't think they could qualify for a Part D plan. For whatever reason, they've never been educated on it, and quite frankly, they don't pay agents enough to go knocking on doors, even if they could, if it was allowed by CMS, God bless them, to peddle Part D plans, because they don't pay anything. So agents are not out there just pushing that as a primary thing anyway. This is not a Part D drug plan. This is not regulated, supervised, or overseen at all by CMS. It has nothing to do with Medicare. This can be for uninsured people. It can be for insured people with a copay at their work. It can be for huge organizations like the state of Kentucky, who distributed this to all their employees, even though they already had a prescription plan. Their prescription plan had a deductible and coinsurance and that kind of thing. This is first dollar coverage. Now, I'll go into some of the details on it, but I want you to see what this involves, and it should be coming up right about now. 100 million people need help paying for prescriptions. That's quite a market. This is a way to tap into that, but think about the big picture, though. The big picture is this is a loss leader that you get paid for, get paid to prospect on, put something in their pocket by handing them something that makes them have a relationship with you on a favorable basis. Now they're opening up on everything. If they're paying $100 a month right now out of their pocket, or $300 a month out of their pocket right now in diabetic supplies, you know, holy mackerel, they need to have something like this right away if they're under 65, or anybody that you know can use this thing like crazy. Well, I want to show you how this works. Go to this one. Basically how this works is this. Every time somebody uses one of your cards, you get paid 60 cents. So the more cards you can give out, the better. And boy, that slide is tiny. See on the bottom right of your screen, there's a magnifying glass. There's a bottom one that's a minus and a top one that's a plus. Click on the plus one if you can. I have no idea why that got so big, that's so tiny, but if you click on the plus sign down there in the magnifying glass, you'll see, and for the purpose of the recording computer, let me do that real quick. Okay, so now you can see this. The question that I'm going to get probably from my friend Paul in Palm Beach, how does this affect the Medicare Part D plan interacting or replacing or anything like that? And it really doesn't. It supplements it. When you go to Walgreens or CVS Pharmacy or any of your local pharmacies, they give you an option of having a primary drug card insurance on file and then having a secondary. And they'll either do one or the other, or they can give a discount based on what's left over from the other. That's when this comes in for seniors that are on Part D. And the donut hole is supposed to be better, a 50% reduction on the cost of those drugs. But if you can save 75%, then why would you save 50%? And all they have to do is show both cards to the pharmacist and say, which one saves me the most money? And that's the one that they'll absolutely go with. And yes, you still get paid when they use them. Now, it's been said on this program right here that the average, and I'll probably find it as we go through. Let's see. I'll get to that in a second. It's a frequently asked questions. This is a zoom in on how Part D will work this year, 2011 year. It's working right now. And once you've spent $2,840 in drugs, now the beneficiary, until this next one goes into effect, the part of the Obamacare plan, where we're going to pay 50% of the donut hole drugs, they would have to pay $1,700 of the next money. Now they can save 75% of all that stuff. So they can save that money. And then I want to show you this. So it really applies to most everybody. These are the questions that most people ask. How does it give you the lowest price? They have two different prices, really. They have a cash price and then they have a discounted price. Whichever one is lower, it's based on usual and customary and pharmacy reimbursements and pharmaceutical company kickbacks to pharmacies and all that stuff and how it works. But it's complicated. All you need to know is if they show this particular card right here, they will get the lowest price possible. And what's the worst that can happen? They save money or they don't save money, but you are seen as a value-added person in their life from handing them a card. You hand them a card and they are often using it. What does the card look like? Well, you get your own website. You can print out the cards. They look like this. I'll show you. Whoa, there we go. They look like that right there, and those numbers off to the side is what everything is. That's how they put it in the system. They only have to have this once, show it to the pharmacist once. It never expires. It also saves uninsured folks money on CAT scans, MRIs, lab tests, blood work, all those kind of things. It saves them money on all that stuff. It also works on pets. If they're pets, anybody know any pet owners? Like 200 million in the country, pets running around. It also works on their prescriptions as well. You can show it at the pharmacist and use it right there at the pharmacy. And put it on the record and on your file, and you're done. That's all you have to do. But this card will, as you can read right there, save money on 21 out of 25 of the most processed drugs for card users. That, even though they have an insurance copayment through a drug plan at work, even though they have a drug copayment of $10 or more. Okay. You can use this in many, many, many places, and they can go to the website and find out all the pharmacies that they can be used. Dwayne Reed? What are you talking about? Sorry, I got a message in there. So anyway, this is a program where, and let me show you how this is being used on a large scale. It's very cool. We loaded up the dialer with this thing, and I probably shared that with you already. Call 1,000 people, and 50 will raise their hand and want it. That's a really good response. And there's a website. I'm going to clear these things out. Oh, list of pharmacies. Yeah, I never heard of that one. That link right there will take you to the site where you can sign up. Now, let me pull up the, okay, yeah, it's on there. There's a one-time startup fee for agents, and what they do is on your website that they create for you, if you want to use a name or logo or your agency name and phone number, you can put it on that card, which is a nice referral piece. Because what you want to say is, look, here's the card. Give this out to as many people as you want. They can print this out from your website, by the way, with all your information pre-printed on there, and you want to tell them, give these out to as many people as you can, and if you need more, let me know. If you give out 100 cards and people are only filling 2 prescriptions each, what does that come to? Go calculator. 100 cards times 200 scripts. Oh my gosh. That's a lot. No, I'm sorry. 100 cards. That's 200 times, my brain shuts off when I go on the camera, times 60 cents each. All right. So you've only given out 100 cards and it's paying your cable bill. That's $120 a month coming in each and every month forever. No expiration on that. I will also let you know that a lot of savvy agents are approaching large groups. And think about this. Health fairs, booth events, county fairs, state fairs, and all that. When they give out their goodie bags to people, if you approach these people and say, look, we want to give them an added value from our agency just as a gift. We want to give this out to people, and we want to give them this free prescription drug card. Just put it in their bags. It's free. And oftentimes, what I'm hearing is those places will pay to print those on paper like this that they can distribute and say, look, give as many away at the top. Give them away, no enrollment required, everybody qualifies. It's a free card, 75% discount on prescriptions, lab tests, imaging services. Save money at the pharmacy, cut this out, and use it and give one to somebody else. So as many ways as you can creatively give these things out, it not only gives out your name and phone number as an insurance expert agency, but it also puts money back in your pocket immediately. There's a guy, Ed, what's his name, on the insurance agent forums doing this similar program, but it's through the other model. I think it's 40 or 50 cents each that they're giving out. And like I said, I went right to the company and got this deal here. They just activated the website today, so that's why I wanted to bring it to you in today's webinar. So you can literally click on that link, get your web page immediately, and when people sign up on your web page, you get to see, I don't think you see their name, but you see the scripts that are going through. You see the discount that they got, the original price, the discounted price, and you see how much you got paid on every single one. What a lot of agents have done successfully in New Mexico is go into doctor's offices and given these out. By the way, when you pay $50 to the company to get set up on your custom website and to give these away on your website link, which you can do, they also give you 5,000 nice, sturdy, real thick cards like this that you can actually give out, 5,000 of those. And you can track these things in real time. So as you want to give these to local providers and doctors and stuff, it's a great way of making referrals to endocrinologists that deal with diabetics, internal medicine doctors, and everybody else that deals with people on a regular basis. And again, if you put your agency name on there, they see something life insurance or something health insurance or Medicare specialist. They see that on your card and they think it's a nice added value, and the doctors think this is something nice you're doing to give away. Do you think people in doctors' offices use prescriptions that same day? So literally they could pick up the card, go right to the pharmacy, there is no activation required at all, and use it right then. I'm going to open up this thing for a few minutes of questions there, but that's the site you need to go to. It doesn't cost anything to go to that site and register, but there is a startup fee, and the startup fee is given back to you in 5,000 cards and your website and all that stuff. So it's a really good, oh, I need to tell you this. Neil is the guy that's at the company, that's the my contact there, and he said that the normal startup fee for this is $100 to set up the website, and with the $100 they give you 5,000 cards. But for this, through the end of the month, this was their deal last month. It was like no charge. It was $50. This month they've extended that. They were going to make it August 1st, but now it's September 1st. And I've got his email right here. September 1st, this changes to $100. So I encourage you to do it now. Get this thing set up. They'll send you the card straight to you. You can use their cards, but you don't have to wait to use their cards. You can literally print them off on a laser printer and go to town giving those things out, putting the flyers out, put them in a take-one box, free prescription card, and people will just take them from you like crazy. Yes, the questions are waiting, and I was slow in getting this up there. If you have a question, throw it up there, and I'll be happy to do my best to answer it. So yeah, they're trying to take Medicare away from us, Medigap plans. You know, the good saving grace there is that 90% of bills that are introduced into the House and Senate never make it past committee. But this one's sponsorship of the most, there's Paul's question. I know it wouldn't take long. 90% of the bills never make it out of committee, but the most influential lobby in Washington, D.C. is the one lobby that's sponsoring or supporting this bill. So there you have it. And here are the questions. Let's see. I had a similar card for years, but your deal is a heck of a lot better. That's because we went to the source, Paul. However, I also use a site called Canadian Drugs. Yeah. You know, interestingly enough, my wife and I had a Canadian drug pharmacy storefront set up about 10 years ago. And we heard of a similar Canadian store, and what we were doing is using it as a lead generation site for Medicare and final expense. It was working great too. I mean, we had hundreds of clients. We're making a great residual income on their prescription drugs. That's before Part D. That's before CMS. Excuse me. And that was fantastic. However, we heard of other Canadian pharmacy storefronts, and many of you remember this. They were being rated by the DEA as being drug dealers. How stupid. And I was also working full-time as a law enforcement officer at the time. Can you get that picture for me? And so that was not too good. So my own legal counsel advised me that it probably wouldn't be good to be let off in handcuffs by a representative of federal law enforcement. There's that ugly picture. Look at that. That's back when I was skinny. So this is the time we were running the Canadian pharmacy too, and doing insurance and working at the sheriff's office. Bobby, I see that. Holy cow, that is cool. Yeah, it sends an email to the agency when you register there to give away the cards. So I just book them, Dano. Thanks, Tom. I see that. John, do you have to be contracted? No, this is open to absolutely everybody. The more people that can save seniors money, the better. Do you have to be, I'm sorry, maybe I read that wrong. Do you have to be contracted with Universal American to sign up for one of the classes? It's not Universal American, it's Universal Healthcare, and yes. And I know there are a lot of them closer, like United Home Life, Universal Healthcare, United Healthcare, Universal American. They all sound very similar, but no. Can you print these on a, and I can't read that last part. Let me just make this a little smaller. Sorry. Expand this out. Can you print this out on the business card? You can. However, their typical web template will throw this together as a PDF that you can print out when you register. So you can print these out, take a picture of it. This is what I would do. Take a picture of it and then put that picture on as an image in Microsoft Word with the template on those cards you can print, mass mailing. Now think about this. Those of you that have send out cards, we're going to be doing a webinar on send out cards soon because they've reduced their price like 99% on signing up for send out cards, and our most successful agents are using it. There's also one of my agents that was featured in Senior Market Advisor magazine as the top 100 best marketing practices for insurance agents. I appreciate that. Tony Rake out of Missouri talked about send out cards and how it gives them tons of referrals. That's probably going to be next week's webinar on how to use send out cards. And since it's only $9 to do send out cards now instead of $467, probably a lot more people want to take advantage of that. But imagine, all that to say, take one of these pictures like this right here. Take the image of this picture by scanning it, and if you don't know how to do that, I can do it for you. Scan that thing and then put it as a picture inlay on your card, and then send that sucker out to all your clients. I mean, we send out cards to all our clients multiple times a year, and I can say, oh, by the way, here's a picture of our family. We're beautiful, gorgeous, great people. See the picture up there? But also, down here is a card you can literally cut out of this card, take it to the pharmacy, and save money right now. And yes, you still get paid because that number tracks back to you. Instantly, you'll be notified when they use the thing. So that's a pretty smart angle right there. And it costs no more with send out cards to send a picture plus card with 15 pictures in it, photographs, or just to send one. So you might as well throw in that card there for all your existing clients, right? I mean, why not? If 10 of them are using it, that's $6 each time. That's great. Tony is great. Yes, he is. Let's see. Any other questions that anybody has? Now would be the time. Now would be the time. Got an email in. On the LEAD program, yeah, this is a webinar that's open to everybody that's on my list, so it's about 1,000 agents, and we're not in a secure environment right now to go over our LEAD program for this year on Medicare. So I can't address that question right now. Does it cover for brand name drugs? Yes, it does, and that's where it gives the most significant discounts. And a lot of seniors, and that's why we used to go to the Canadian pharmacies, because they have to take one specific brand name drug. Probably has something to do with the doctor kickbacks from the pharmaceutical rep that's gorgeous and comes in their office 15 times a week. I don't know, but be that as it may, they only write a script and it says name brand drug only. In that case, yes, this will save them money for sure. What does it cover for pets? Just medicine or office visits? Is that really you, Ryan, that asked that question? It's a prescription card, so it only covers prescriptions. And see right here on the back of my card, it says, well, you can't read that. Have pets. If you have a pet, blah, blah, blah. Yeah, bring it in the office and you can use it on the pet. I'll show you my card. Let me see. I'll give you a link where you can see my actual card. Because when you register, they give you a link and you can email it out to your entire list of clients right now, and they could sign up instantly. They don't actually have to sign up. They can print out your card immediately and use it. Let me show you this. They sent it to me in several different ways. That's the one for the login screen. Hold on one second. Neil sent it to me today. Okay. Yeah, it's this one here. If you click that, you'll see it's probably the one at the top too. Yeah, they're the same thing. Click on that link and you'll see that you can print the card that's referencing my deal right there. And I'm going to change that thing on my deal to be something like Health Insurance Saver or healthplandirect.com, which is a domain that I own, something like that, or Senior Helper, something. And they can click on that. That's a Java button, and it'll print the card. Or at the bottom of that page is where it says Opportunity, so you can find out the same thing that I've got. So click on that link, go all the way to the bottom where it says Opportunity, and then click the link at the bottom of that page, to click the link at the bottom of that page, sign up and become an agent today. Bam! There you have it. My dog goes a lot to the doctor. I'm sorry to hear that, Ryan. Alrighty. Let's see here. Woo! And there we go. All right, for those who joined us late, I'm going to roll some of the B-roll footage of our friend John Kerry, who's trying to destroy the capitalist system and the Medigap plans as we know it, but I have no hard feelings against him. Hopefully we can all rally together, and those of us that are on the other side of the aisle that have common sense, and those in the private industry of insurance, which also has a big lobby, just not as big as the one I mentioned earlier, we can rally around together and stop this thing from happening. But the first video I'm going to show you is about the medical loss ratio and how it applies to major medical and how they propose right now to make this happen on everybody else. Thanks, everybody. Have a wonderful day. I'm going to leave the link up there for the prescription drug thing. I'm probably also going to take it full screen and put the other links on there for the universal training. If you missed that, click on the link and see where the training is happening near you, and also get contracted if you haven't yet. Thanks for your time. You'll have a wonderful Wednesday, and email me if I can help you. I'm going to put that email address here too. Thanks for your time, y'all. Bye-bye.